Reasonable and necessary frequently asked questions. To fund supports, the NDIA needs evidence that the following criteria are met. First, the support must help you achieve your goals. The support must also help you with activities that facilitate your social and economic participation. The cost of the support must be reasonable when compared to the benefits achieved and the cost of alternative supports. This criteria doesn't mean that the support has to be the cheapest option. More expensive supports may be considered value for money if they are more beneficial or may reduce the need for support over time. The support must also be likely to be effective and beneficial for you. That means that it does what it is intended to do and it will help you maintain or improve your function. Evidence to prove this can include medical journal articles and statements from participants about the benefits. As well as this, the support must not be something that could be reasonably expected to be provided by your family or friends. To determine if a support meets this criteria, the risk and benefits will be considered. Detailed carer statements are useful in demonstrating the level of care currently provided and why that is difficult for the support person. Lastly, the support must be most appropriately funded by the NDIS and not more appropriately funded through a mainstream service system, for example, by the health or education systems. The NDIS will not fund diagnosis and treatment of health conditions, but they may fund allied health therapy where there is a need to help a person with disability participate in their community. Generally, the NDIS will not fund day-to-day living costs. They may fund supports in circumstances where day-to-day living costs are incurred solely and directly as a result of a person's disability support needs. For examples of day-to-day living costs funded by the NDIS, see QAI's fact sheet on NDIS reasonable and necessary supports. If a service is more expensive because of your disability, the NDIA may choose to not fund the whole service, but they may fund the gap. If you have questions about the things mentioned in this video, please contact Queensland Advocacy for Inclusion, or QAI. QAI can be contacted via phone on 1300 130 582 or 07 3844 4200.